Time once again for a look at what is making headlines in the field of heart health. Joining me in studio today to talk about heart disease in women is the director of the Baptist Heart Institute, Teresa Dawson. And Teresa, welcome to Smart Medicine's Heart of the Matter.
Thank you. Good morning.
It's a privilege to have you here today. Let me ask you this. How do heart attack symptoms for women differ from those of men?
Well, Joe, quite often the symptoms in women are more subtle. You know, for men, we tend to think of that crushing pressure or the elephant on the chest, and women may experience that as well. But far more often, we see women presenting with what they describe as a fullness or pressure in the chest. It may radiate up into the neck. It may radiate out into the shoulder. But we also have concerns about ongoing fatigue. If women have been able to do their normal activities and suddenly they feel that they are tired and fatigued or something that's repetitive, then we ask them to be sure and check with their doctor. That could be a symptom of heart disease.
What are some heart disease risk factors for women?
Well, heart disease is now considered a lifestyle disease, and some of the risk factors are smoking, uncontrolled blood pressure, diabetes that's not controlled well, and then just that sedentary lifestyle, not getting enough exercise, not eating plenty of fresh fruits and vegetables. Those things over time contribute to the development of heart disease.
Now, is it mostly older women who need to be concerned about heart disease?
No, that's a fallacy, and that's part of what we're trying to do with an awareness campaign that you may have heard of, Go Red for Women, is to help women to know that they are at risk for heart disease. We're seeing it at earlier and earlier ages, but those risk factors increase around the time of menopause for women.
What can women do to prevent heart disease?
Well, one of the best things that we can do is to start to take care of ourselves, to get an annual physical, to know our risk factors. There are many reputable websites out there that give information. American Heart Association's website's an excellent one. But to know our own bodies, to know our risk factors, and to talk to our physician about our risk for heart disease.
And we know that quitting smoking, exercise, and eating a healthy diet are three of the key components into healthy living.
That's right. Not only to prevent heart disease, but to prevent many other diseases and illnesses. Plus, it makes us feel better.
You feel better about yourself.
That's right.
All right. Teresa Dawson, it's a privilege to have you here on Heart of the Matter here on Smart Medicine. Thank you for joining us today. If you want more information about the Baptist Heart Institute or anything else you see here on Smart Medicine, you can go to the website baptistonline.org or smartmedicine.tv.